The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Good morning and welcome to Aging Horizons. December 7th is coming up pretty quick, and as you know, that's the deadline for you to evaluate and possibly choose another Medicare Advantage plan. What do you want to consider? Well, we'll be talking about that in this show. We'll be talking with Kimmy Everman, who's an expert in this field, and we're talking about SHIP counselors who can help you throughout the state, so stay tuned.
No one likes to have to ask for help. It's a courageous act.
Sarah Solomon, Energy Share Coordinator.
Our clients work hard, sometimes at 2 or even 3 jobs, but still struggle to keep the heat on. They're doing everything they can. They're proud and they don't give up. I feel inspired and honored to work together with these Montana families.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Respite Care is amazing. If you are capable of doing it, the rewards are beyond measure.
Stephanie Young, Respite Care provider, on the unexpected benefits of helping people in need.
Being a Respite Care provider is an amazing experience. It's something that what you give, you get back 100-fold. You receive so much more than you could ever imagine.
To find out how to change lives, including your own, go to respite.mt.gov.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Brian Lamore, and we'll be talking about Medicare today. Coming up, December 7th is the last day to choose a Part C plan and possibly a Part D plan. We'll be talking about what goes into the considerations for that so you can have a plan that you're happy with. If you're a little uncertain about making those choices or understanding what it does, we have SHIP counselors throughout the state, and maybe you have some family members still around that might be able to help you. Joining us today is Kimmy Everman. You're a communications and outreach specialist with the Department of Public Health and Human Services. Welcome to your show.
Thank you, Brian. It's always good to have you here as well.
Well, I really enjoy this. And, you know, we're talking about the deadline coming up, December 7th. What are some of the decisions that have to be made by then? And what are some of the evaluations you want to do with your present plan to see if you want to stick with your present providers or different providers?
Great questions all. Just want to really encourage folks right out of the gate, though, you only have a week or so left to get this done. So if you want to be sure that you're getting the best plan for 2022 and the best coverage in your Medicare universe, you need to check this out right away. What's really important is that many folks stay with the same plan, and that's totally okay from year to year. We just, as SHIP counselors and Medicare advocates, we encourage everyone to just look at that plan and the form it's coming in 2022 because it could have changed from 2021. Now, let's say that you're working to maybe sign up with the same plan you had last year. You want to read anything that the company has sent you you. If you have questions, call their customer service line, look at their website, and definitely use the Medicare and You 2022 book. It's a great book and will really, it simplifies everything to me and really flows very, very well. So I'm going to say definitely take a look at that. But also, you still have time to call a SHIP counselor. And let's put the number up on the screen so that people can grab that. They may not have an appointment at this time, but they may have a few minutes to be able to chat with you, because it's so important that you do this. And if you have questions or concerns that you don't know how to do it yourself, give them a call and see if someone can talk with you for a few minutes. And then really, I want to say that over the years, I've come to really like the Medicare.gov website. Very easy to use. Every year it gets better and better. There are tutorials there, so if you've never used it before, you can go and see how to use it, and do this yourself if you're so inclined. Because we are running out of time during the open enrollment, the annual open enrollment. I just want people to, get taking a look at that information and then reach out if you need to, because we're happy to help.
Okay, and you did receive in the mail this Medicare and You book. What's important about it is that it covers everything, and it's not just till December 7th, the end of open enrollment. You keep it year round because you can answer questions.
It's your handbook. That's absolutely right. It's your handbook, and you should keep it around. I used to always tell folks, this is not to put your coffee cups on. This is to help you understand your benefits. Be Medicare aware. Know what your benefits are and use them to the best of your advantage, because you earned them. You worked, you took you took care of your family, you worked in your community. You deserve the Medicare that's coming your way.
Yeah. Now, if you're looking at a Part C Medicare Advantage provider, what's important is that there's a number of providers, and it's not like they provide, Medicare provides a standard, but they choose which different things to cover. And what are some of the considerations that we want to think about when we're saying maybe a Plan C is good for me? Well,
a Medicare Advantage plan it's a plan that's sanctioned by Medicare, only it's delivered through a private company. And they have to give you as the beneficiary all the A and B benefits, plus they usually have a prescription drug piece that goes with it. But then there's in the middle where the Advantage comes, which they may offer extra benefits like hearing, like vision, just any number of things that original Medicare doesn't cover. One of these other companies or plans may cover. And if you're a person that needs dental, needs vision, needs hearing, these are places where you want to look and see, is this a plan that might work for me? It's not original Medicare with a Part D plan, but you're still a Medicare Advantage, or you're still a Medicare beneficiary with all the rights and benefits.
Because Medicare doesn't cover dental and vision and hearing, so the Part C or the Medicare Advantage people can provide that.
Right, and until we have that coverage under original Medicare, it's at least an opportunity.
And those services are very important. I mean, they're key to maintaining good health. And you cannot go with a Part C, but we'd suggest you then also see them on your own.
Right, exactly. Yep, that's exactly right. Those are very big parts of staying social and staying independent.
And healthy, maintaining your health. Well, we're quickly drawing to a close on our first segment, but we'd like to recap a little bit, is that you have until December 7th to choose a provider. If you choose to go with Medicare Part C, and if you want Part D drug coverage, which can be very important. So review the book that you have, talk with your family members if they're willing to help, and talk to a SHIP counselor. And we'll have a lot more great information in our next segment, so stay tuned.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare. The deadline's coming up, December 7th. There's some decisions to be made. And Kimmy, an important part of our Medicare, what the state and other programs choose to do, is what's called helping programs. What are they and how do they complement Medicare?
Well, they're some of the best programs that I know of existing because they are there to support our very hard-working population who deserve that support when they're in their retirement years. And it's, I always say it's a hand up, not a handout. You've given to your community for years. So reaching out if you need some assistance, please do it. And please call a SHIP counselor. Let's put that on the screen and give them a call, because not only can they talk to you about Medicare and the kinds of benefits you get, but they can also tell you about these helping programs. So I want to start with the first one that is a helping program attached to Part B. Now remember, Part B is your outpatient kind of services where you're going to the doctor and things like that. So Part B also has a premium under Medicare. And with the Medicare Savings Program, you can get that Part B premium, which I don't know the exact for next year yet, but we're projecting about $158.50 a month for, and that's only, I want to say that's only up to a little less than $10 from 2021. So yay, good value, Medicare, keep up the good work. So anyway, the MSP helps pay that depending on your eligibility criteria, because it's financially and asset driven. You may be eligible for some other little benefits around that Part B. Okay, so then we're going to move to Part D, where we have a couple of helping programs. The first is called
Part D's pharmacy.
Yes,
right.
I'm sorry. Yes, D is pharmacy. So we have the low income subsidy, or LIS, or extra help. We've got a lot of different names for it, but what it does is help a person pay premiums for their drug plans, pay some of the out-of-pocket costs, perhaps deductibles, things like that. Again, depending on your financial and asset-driven eligibility. So you want to look into that. There's two great programs, B and D. You're going to have practically no out-of-pocket for those. Another with the D that I don't want to miss is our Big Sky RX program, which is a Montana program, born and raised. We've had it for all the years that we've had the Medicare Part D, and it's a wonderful program. And it helps pay monthly premiums, not deductibles and things like that. But the good thing about those guys is that it doesn't really matter how many assets you have.
Yeah.
It's an income eligibility. So you can have, and that happens a lot as we age. We have maybe some assets without liquid cash, perhaps.
Yes.
So that's another good one. And then, of course, if you really are in need of more support than that, you become a dual, which is a Medicare, Medicaid beneficiary. Again, all these things you can talk to your SHIP counselor about that. Because for one thing, these subsidies or these helping programs may help all across the parts of Medicare that you have, Part B, Part C, or Part D. So you want to find out if there's any way that you might be eligible for that.
And you know, sometimes people will get online and they'll look themselves and they'll find a program and they might not be eligible. What's important is that you don't stop there. I mean, talk to a SHIP counselor because they know all these different programs, but also they're a part of our area agencies on aging in Montana.
Exactly.
And there's programs beyond health insurance like Meals on Wheels, Senior Center, Ombudsman, legal services, and they can help you to access that also.
Right, and your first call to that SHIP counselor gets you right in that door. There is no wrong door in this kind of environment. We encourage and want folks to come to us with their questions, their concerns. It's always better to be proactive than not. And you know, before that barn gets out, or that horse gets out of the barn, we want to make sure that you've been able to ask your questions, get all the benefits you have coming to you and just have a support system.
Right. Well, now, Kimmy, we have a December 7th deadline coming up for choosing our Part C people or our Part D plan. But with these helping programs, are they also under the same time constriction? You have to apply before December 7th?
No, you can apply for one of those helping programs at any time. All year long. We know that sometimes major changes happen in households with income and such, so you may have a change. But remember, those are programs that are attached to Medicare, so it isn't just any kind of program. It's all attached to Medicare. And you want to just really reach out. And get whatever information you can. And you know, they're not going to take your birthday away if you're not eligible. I always say that. And you've made a contact in the community at that area agency that you might very well need in the days to come.
Yeah.
We want you to do it.
Because our situation changes. I mean, we look around to all our friends and family, and we've seen that, haven't we?
Right, exactly.
Yeah, and so give the 800 number a call.
Yeah, absolutely. And as you always like to say, Brian, they have nothing to sell you. They're completely objective. They're highly trained. They're trained on an ongoing basis. It's not like they went to one Medicare class, because as everybody knows, that's a moving target.
Yes.
You need to continually be learning about Medicare to stay on top of the things. So these are men and women who are just absolutely committed to taking yes, and providing Medicare advocacy for you.
That's great. Well, we got a lot more information in our next segment. Stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, when my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Welcome back to Aging Horizons. I'm your host, Brian Lamore. A big issue up these years is COVID. And Kimmy, Medicare is basically health insurance for us. And how is Medicare working to address COVID? Is it really helping us out a lot?
Oh, absolutely. And I've said so many times over the years how proud I am of Medicare for being so forward and proactive in so many of the things that they do now. One of the things with COVID is that Medicare is covering those vaccinations for sure. And we learned something really kind of interesting off camera, that if you belong to a Medicare Advantage plan and you're going to get your vaccination, be sure you have your regular Medicare card along with you, as well as your MA card, because it's the federal Medicare that's paying for those and they'll be reimbursed for it. So you want to be sure you have that. But there's some other stuff that's great besides a free vaccination, and telehealth is right at the top of that list. They have what they're calling virtual check-ins, and they're expanding all the time to allow more and more telehealth to take place. For folks that maybe aren't familiar with that, it's you get to talk by computer or by phone to your doctor or your care provider instead of having to get in your car, drive in below zero weather in Montana in snow. And of course, if you have a broken leg, that's not going to work. But I want to tell a personal story, and that is that I do virtual health a lot because I just take medication that has to be followed month by month. But I don't want to go there every time. And my doctor has allowed me to do that. And so under Medicare, they're doing a lot of that to make it easier on folks to stay up on their health concerns, because you know what? 73% of Medicare beneficiaries have chronic health issues. Now, that might be something as not that big a deal, as, well, high blood pressure if you have it, not that bad, I guess, all the way to other kinds of really major health concerns. Just really, really important to have those things on the table for our benefits. And another thing that they're doing to expand sort of services is they might, and this is mostly Medicare Advantage plans, they might be including meals, transportation to health appointments, nutrition counseling, home safety kinds of things like shower grips or ramps, that kind of thing. So with the telehealth expanding and some of these extra services expanding under Medicare, people have a great opportunity, if they want to look into it, to see if something like this might work for them. And Brian, I know that the open enrollment for the year is over, but we have to remember that January 1st through March 31st is the Medicare Advantage kind of open enrollment. I mean, what I say is that's a time frame when, gosh, you're in a Medicare Advantage plan already. You must be. That's part of the eligibility criteria. If you want, you can change to a different plan or you can go back to Medicare Original or Traditional with a Part D plan. And that's outside of that that open enrollment that we're seeing come quickly to
December
an end.
7th.
So you might have that, but don't wait. I mean, I'm not suggesting to just wait. Do your homework. Do you need any of these open enrollments? Do you need any of these helping programs? Call a SHIP counselor.
Call a SHIP counselor.
That's all I can say. Call a SHIP counselor.
They're there for you.
Yep.
Particularly, in these times of COVID, you want to be aware and you want to have all the benefits that's available to you.
Right.
If you question your health at all, that it could be COVID, talk to your doctor.
Oh, absolutely. And if you have any question about COVID coverage with your Medicare, call a SHIP counselor. They're happy to. If they don't have the information, they'll get it for you, or they'll get you to the person who can give you that information.
Well, what about COVID testing? That's very important to have done if you're questionable. Does Medicare cover that, or is there a cost to it?
Well, you know what? I don't know, but here's what I would say about that, Brian, because I think it's different in across the state here anyway. I would say talk to your doc. Always talk to your doc. Call up, especially if you think you have COVID. Call up and have that conversation, either with their nurse or your doctor. Let them make the decision, and then they will. I know that for a little while here in Helena, we were out of rapid tests because so many people were getting tested. But I think we're better now, and you just want to call your doc. And I just want to really encourage all Medicare beneficiaries not to let their chronic health conditions go on without talking to their physicians. That's why we have Medicare coverage, so that you can do that, stay happy, well, independent on your own.
Yeah. And if you haven't had your COVID shots yet, talk with your physician.
That's right.
Get their recommendation. There's a very good chance they'll say do it. And I'm sure Medicare would cover that also. There's an advantage to that.
Yep. And get your flu shot at the same time, and maybe your shingles shot. I just think, I love Medicare so much for all the things it gives for folks, and I just hope that folks take advantage of it.
And you get a yearly checkup also, don't you?
Indeed.
I do that around my birthday, so I remember when it is. Actually, you do it once and they start scheduling a year out.
See, there's so many things that Medicare, it isn't like your grandma's Medicare anymore. There's so many more areas that it's expanding into that fit our lives now a little bit more, and what we know to be more important, like that baseline health.
So that we can stay better, healthy, and wise. And for our
absolutely.
viewers, I want to thank you for joining us. I hope we've been very educational to you, and we look forward to seeing you on another Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.